Right to go? Okay. Thanks, everyone. Thanks for joining us again here this morning. And I'm joined by Martin Foley, the Minister for Health, and Professor Sutton, our Chief Health Officer. As I've said a few times, we've got a bit to get through, so bear with us. I'll take you through the easing of restrictions as we have foreshadowed over the last week or so. Then we'll hear from Martin and then finally Professor Sutton, and then happy to answer any of your questions. So there is one new locally acquired case today. Thanks again to our hard-working contact tracers. This case was quarantining during their infectious period. There are 83 cases of coronavirus in Victoria, of which 68 are linked as active cases to the current outbreaks, with further cases who have recovered. 19,533 Victorians got vaccinated yesterday through our state-run centres, with many more rolling up their sleeves at our GPs across the state. Over 28,000 Victorians got a test yesterday at one of our roughly 200 testing sites. So thanks to these very high testing numbers, our public health team are getting a better sense of these outbreaks that are moving through our community. We always said that we would ease restrictions, carefully ease the rules. Where we can, we would, and Victorians have done an amazing job following through the rules and getting tested. It's why today, on the advice of the Chief Health Officer, we can announce some significant safe steps. So, from 11:59 p.m. tomorrow night, Metropolitan Melbourne will move to most of the same settings currently in place across regional Victoria, and regional Victoria will move further towards further easing. So for Melbourne, that means the 5 reasons to leave home will no longer apply in Metropolitan Melbourne. The existing 10-kilometre limit will be increased to 25 kilometres. That means the only reasons to go further than 25 kilometres will be for work, education, caregiving or getting a vaccination. Travel into regional Victoria still remains a no-go for now. We're also still not in a position to be able to have visitors in our home, but outdoor gatherings will be increased to a maximum of 10 people. Schools will be able to resume face-to-face learning from Friday, which is great news for teachers, staff, students and parents. Masks will no longer be required outdoors unless you cannot maintain a 1.5 metre distance, but it's important that everyone continues to wear them indoors, whether that's shopping, on the train or at work. Funerals are limited to 50 people, while weddings are limited to 10. Religious ceremonies will be capped at 50 people inside. Officers will be able to return with 25% or a cap of 10, whichever is greater, but we're still asking people to work from home where they can. Restaurants and cafes can reopen for seated service with up to 100 people per venue and a maximum of 50 inside. Retail can reopen in line with density limits of 1 person per 4 square metres. Hair and beauty therapy can also resume for treatments where masks can be worn. Community sport can return to training in Metropolitan Melbourne. Auctions can happen outdoors with a maximum of 50 people. Some entertainment venues and community facilities will also open in line with density limits and additional caps, and they're in line with the current settings in regional Victoria. So in terms of the further easing that we can provide for our regional Victorians, from 11:59 p.m. tomorrow night, the changes include visitors to home, so that's limited to 2 adults per day, plus their dependents. Public gatherings will be increased to 20 people. Restaurants and cafes can open to a maximum of 150 for the venue for seated service, including up to 75 allowed indoors. Religious ceremonies will be capped at 150 for the venue, with no more than 75 people allowed indoors. Funerals will be limited to 75 people, while weddings will be limited to 20. Officers will remain capped at 50%. Community sport is back for all ages, both for training and for competition in regional Victoria. Finally, regional Victorians will still be able to travel around regional Victoria, Melburnians will not. I want to flag what the next stage looks like. We're trying to give as much notice to people as possible, and so we'll have more to say about what the next stages of easing will look like next week. But I want to assure people that, subject to the public health advice, the epidemiological conditions through the next week, we expect to be next Thursday night that the regional metro divisions will come down and we'll be able to travel more freely around the state again. For Melbourne, we'll be looking to further ease restrictions on venues. Community sport will be able to come back for competition. So again, this allows local sporting clubs to start planning for what the weekend after next looks like. We want to see what more can be done to further ease restrictions safely on businesses without jeopardising the gains we have made, and we'll be looking again to make some further changes for regional Victoria. We'll continue to assess the data each day and provide more detail, more certainty as soon as we can. Another thing I want to put on people's radar is in regards to QR codes. On the advice of the Chief Health Officer, we will be moving to make QR check-ins compulsory for all workplaces with very limited exemptions. Previously, it's only been mandatory for customer-facing businesses, but through this outbreak, we have seen a number of cases occur in office settings, so we want to take the next step on this. We will be looking to consult with industry over the next few days around implementation, and we'll finalise the details next week ahead of the requirements coming into effect. But again, we want to foreshadow the changes that we are working on. In terms of business support, with the restrictions easing for Melbourne that I've just outlined, we know that some businesses, so for Melbourne, like gyms, amusement parks, dance studios, nightclubs, they'll need to remain closed for a little while longer. That's why I'm announcing a further $8.36 million to provide an additional $2,000 grant to support thousands of businesses eligible for the Business Cost Assistance Program that remain closed under the restrictions that I'm announcing today. So finally, everyone, this is a good day. This is a good day. Everyone should be absolutely proud of what we've all achieved together. But we know that this isn't over yet, and until we have widespread vaccination across Victoria and across our country, the virus will still be with us. So we cannot let complacency creep in, and I'm asking everyone to keep doing the right thing. Follow the rules, check in, get tested if you're feeling unwell. We're into the depths of winter now. People will get the sniffles. Any symptoms, please go and get tested. That's the most important thing that you can do. And if you're eligible, please get vaccinated. We're making some big steps today. We're announcing some big steps. This is a good day, and based on the work and the support of all Victorians, we are in the position today where we can announce the end of the lockdown and the 5 reasons to leave home, announce easing of restrictions in Melbourne and further easing in regional Victoria. I'll now ask the Minister for Health to speak, then we'll hear from Professor Sutton, and then happy to answer your questions. Thanks, Martin.
Thanks, Acting Premier. So just a bit more information on the circumstances of the outbreak. So today's locally acquired case is directly linked to the Stratton Finance workplace, and like many of the cases we are currently managing, this person was quarantining securely during their entire infectious period. As we know, we've seen multiple outbreaks driven by the different variants over the course of the last few weeks of the virus moving around our community. And here's where we stand for each of those different aspects of the outbreak as of yesterday. In the City of Whittlesea outbreak, we've identified 1,500 primary close contacts to that outbreak, and the Port Melbourne outbreak, we've seen 2,100 primary close contacts. These numbers are continuing to fall each day as people finalise their quarantine period. And as these numbers fall, so too do the list of exposure sites linked to these aspects of the original part of this outbreak. There are now fewer than 200 exposure sites online, and we expect as sites and primary close contacts continue to be cleared, that figure should continue to come down. In regards to the private residential aged care outbreak, the Arcare Maidstone location, where we've seen 1,057 primary close contacts. That number grew as a result of the case associated with the family member yesterday, and a number of his sites have been added as of yesterday. With the West Melbourne cluster, which is still moving and shifting, in fact, we've seen that number of primary close contacts grow to 1,112. Obviously, the majority of test results that continue to come in from the outbreak have given the public health team the confidence that they need to make these recommendations that the Acting Premier has just announced. But I should add that when we break down primary close contacts by outbreak, there's a degree of overlap for particularly the Port of Melbourne group and the Whittlesea outbreak. Some of the sites of recent concern that we've been looking at, I can advise that of the 490 contacts for the Pro-Build site, 442, that is 90% of that site, have returned negative results as of yesterday, and we'll just run down the last few over the course of the coming time. There was the jewellery cluster of organisations at 227 Collins Street. I can advise that of the 53 contacts there, 46 have returned negative results as of yesterday. That's running at 87%. Of the primary close contacts linked with the primary school, we've identified even though the numbers have increased, once the initial group of primary close contacts was identified at 865, 558 of those have had negative tests received. But as that number grew yesterday, we will expand that testing regime yesterday and today, and we will expect those numbers to come in. So we're continuing to work through the clearances of the primary close contacts throughout this outbreak in the many, many thousands, and those people are increasingly getting to the end of their quarantine period. I just want to express our great thanks to that group. They have done it really extensively on our part, on behalf of us all, to take the hard steps to keep themselves quarantined, to keep themselves safe, but to allow the public health officials the certainty to know that this virus isn't circulating as a result of them circulating, and to give us the confidence that increasingly our public health teams, our contact tracers, can test, trace and isolate and break those chains of transmission. And can I thank you all for taking the extraordinarily challenging steps you have of having isolated over the last 14 days, or indeed as your period of quarantine continues for those who are still in quarantine. I just want to put out a call today, as we've been doing every day for the next few weeks around getting tested. We've seen huge responses for the testing call out that we've made over the last few weeks, and we've seen unprecedented levels of testing numbers and the continuing high turnaround of those pathology results within 24 hours in a day to meet, if not exceed, the national standards. Those tests are so important. particularly as we enter the winter period, particularly as we enter the high risks period that goes with winter, with still, as part of the national rollout of the vaccine program, even though we're ratcheting that up, we still have very low rates of full vaccinations. So being tested is so important, particularly until we build up that higher level of vaccinations. I would just stress, as we have been over the last few days, the most important thing you can do with the earliest onset of sniffles is don't go to work, don't go to school, get yourself tested and stay isolated until you get your negative result. There are testing centres all over Victoria. They continue to operate. You can visit coronavirus.vic.gov.au for the nearest one opening near you under the Where to Get Tested banner. And you'll also see the opening hours and also see the online demand figures there. So if you have symptoms, please get tested. I'll just finish by saying that today is a significant day, as the Acting Premier has pointed out, but this is still not over. We still need to step carefully through the processes of keeping Victorians safe and making sure that all the efforts that we've put in, all the sacrifices that have been made, continue to get us every step, every week, to a better outcome of a reopened and safe Victoria. So I might ask Professor Sutton to say a few comments.
Thank you, Minister. Really just a huge thank you from me. I do want to reflect again on all of those people who've stepped up to get tested over recent weeks, really through the whole of this pandemic. It will be our protection going forward. It is super critical over the next couple of weeks. To have 25,000 tests a day, absolutely fantastic. I would continue to encourage anyone at that first sign of symptoms, no matter how mild, to come forward and get tested. We have found cases in the community that we would not have otherwise found because people stepped up to get tested. Obviously, we've got primary close contacts who are going through testing and we're following up those test results. But for anyone, and there might be people who are still undetected as cases in the community, if you get tested, we can drive this back down to zero. So just a huge thank you from me for those individuals. And then in particular, everyone who's made a sacrifice through this period of lockdown. It is an awfully painful period. I've always had in mind that we need to do what's required to make sure that we get back down to zero. There is really no alternative. Our national strategy of aggressive suppression is there for a reason. If you don't get to zero, there's no grumbling along with one or two cases. This started with one case in Wallet that has led to almost 100 cases over a period of a few weeks. So we absolutely have to drive back down to zero. That's been the national strategy for a reason. It's what allows our travel bubble. It's what allows our internal borders to be open again. And we don't want that pain for our border communities. We don't want the pain of struggling with ongoing cases that just continue to pressure us and, put at risk a giant epidemic until we've got that vaccination coverage. And so again, to see all of those people who are quarantining as primary close contacts in their thousands, a huge sacrifice. It is no easy task, and so a huge thank you to them. And then just for everyone, it is not an easy period. We're still not back to normal. We do have some days to go, but again, with the minimum safe restrictions in place, that is really to make sure that we can continue to drive cases down, but to do so with the stepping out that allows us to start to live a more normal life. It remains a sacrifice. Kids home from school is bloody hard. As a parent of three in primary school, it's been hard enough for me, but there are many people who've done it so much harder as they juggle work or juggle being at home and with all of the trials and tribulations and traumas that are associated. So I just want to recognise that for every Victorian, but happy to take questions.
Can I ask you about continual closure of gyms? What's the medical advice?
Sorry?
What is the medical advice supporting the continual closure of gyms in Melbourne?
The continual...
Closure of gyms in Melbourne.
Gyms are a high-risk environment. I understand, again, the pain for those gym owners. We've had significant outbreaks in gyms through the second wave in Victoria. I think we had 27 cases in a gym. An international experience suggests that even when you've got high levels of testing, including for some gyms where they test people before they come into the gym, that the combination of indoor settings, closed environments, people exerting themselves, really has significant opportunity for spread. I don't expect gyms to be closed for a long time from now on. I am asking gyms to make that sacrifice for a further week as we can assess the epidemiology over the coming week. And of course, there's that support package in recognition of that.
But have you looked at gyms and worked out that there's absolutely nothing that can be done under the strictest circumstances to allow them to operate? There's nothing at all?
Look, of course there are things that help to mitigate risk, but at this juncture, closure is the appropriate measure. That's the view of the public health team that's advising Alan Cheng and myself. It's our collective view. As we open gyms again, they know to do all the things that we ask of them. Of course, they're fastidious about surface disinfection, but it is that aerosol spread when you're exerting yourself that's very hard to mitigate unless you've got an open-air gym. To the extent that people can exercise at the moment outdoors, and it's not a pleasant week for that, and I recognise that, but that is the safest thing to do. It is 20 times safer to be outdoors in gatherings than it is indoors.
Did you at all consider reopening gyms with density limits?
I can't hear.
Can you talk us through how the 25-kilometre limit came into place? What's the public health advice behind that specific figure, and will you release that public health advice?
Look, it's really as it's been right through, the constraint on the distance that you can travel limits the potential for contact with people across Melbourne. We've restricted travel into regional Victoria for the same reason, and we've seen that play out with ongoing protection of regional Victoria. It is the same kind of principle across metropolitan Melbourne. If you have the full freedom of movement across Metro Melbourne, and we've seen at its peak hundreds of exposure sites, people move for essential work enough. If you have everyone moving without constraint, then those exposure sites, the ability to transmit across the whole of metropolitan Melbourne increases.
Are there any cases among the current outbreaks that would actually have been prevented by a 25-kilometre travel limit, bearing in mind that people would still have been going to work and leaving home for the 4 reasons?
Look, I imagine so. The dilemma, as I've often referred to in public health, we don't know exactly what might have been prevented, but I expect...
In most cases, you know what the exposure sites were, though. Are you aware of any exposure sites where people were further than 25 k's from home for reasons other than the 4 reasons and transmitted the virus?
No, but we know that people have been to exposure sites and picked up the virus. If they had travelled from further away, then the potential for spread even further from those exposure sites would have been greater. There's no question about that.
For the first couple of weeks of these 2 clusters, though, people were free to move around.
Yeah, that's right. But we know that people can pick it up at exposure sites through contact with cases who are there. And so the further that they can move, the greater the opportunity there is for spread across Melbourne.
Pretty minimal easing, Professor. A lot of businesses probably won't be economic under the current caps. You can't visit someone in their home. We've got a lot of people in quarantine, a lot of primary, secondary, third ring contacts. I'm wondering what parts of the outbreak you're most concerned about for undetected spread. Where do you believe there are people not in quarantine who should be, who would spread it if we were to open up fully today?
Well, if I knew where they were, we wouldn't be worried about them. It's potentially undetected cases out there, and we've had a few mystery cases over the last couple of weeks, as recently as a week or so ago. So it is needing to have that high level of testing in coming days to be absolutely sure that there are no undetected chains of transmission. The Delta variant is one in particular that's obviously been discovered through people coming forward for testing, that doesn't have that intermediary case necessarily with hotel quarantine, that I would want to be absolutely sure that we can find if there are any cases. But also with the other variant, the Kappa variant, we've had a number of cases where acquisition isn't absolutely clear. So we just need to run that down as much as possible. And that means testing, especially across Metro Melbourne.
It's particularly that missing link from May 8 to May 25. That's what you're most concerned about?
No, that's not the greatest concern. It really is anyone who's out there at the moment with symptoms who's not getting tested, who could be a case. So, 25,000 people testing, absolutely fantastic. There'll be other people with mild symptoms. I just encourage them to also come forward and get tested at the earliest, because that'll identify them, they'll isolate their close contacts or quarantine, you run everything down.
So are you thinking that testing, if everything goes to plan, when do you think that we'll snap back to where we were a few months ago in that COVID normal?
Oh, it is a week-by-week prospect. As the Acting Premier has flagged, we are looking aspirationally to the kind of levels that regional Victoria are moving to now in a further week. That would be my hope. But we've been surprised on a day-by-day basis around what can emerge, and we have to recognise that it remains a reasonably volatile situation. The idea of a snapback to absolutely no restrictions whatsoever, no one's done that after significant community transmission. It didn't happen after Avalon, it hasn't happened after other significant community outbreaks, and so we have to move by increments safely, but with the minimum restrictions that we know will continue to control this.
Are we talking weeks or months?
If we manage to get down to 0 cases like this week, would there be any prospect of easing restrictions earlier?
We will assess on a day-by-day basis.
You said.
Can I ask the Acting Premier just a quick question if I can? You've announced an extra payment, that $2,000 payment. Can you explain who will benefit from that, who will benefit from it, who it goes to and how they apply for it? Just because there'll be people that really do need money now.
Yeah, so this is acknowledging that for this week in Melbourne, there will be some businesses that will need to remain closed. So dance studios, gyms, amusement parks, nightclubs, and like businesses. We think that's around, it's a few thousand businesses. So we wanted to acknowledge that that's going to be a hardship for a further week. And through the business support grants, it's an additional top-up that will be available through the Business Vic website.
So are there people that weren't eligible that will now be eligible, or it's just extra money for more businesses who were already eligible to apply?
Yeah, it's for the businesses that were eligible but continue to be impacted. So just like we did for the previous week in regional Victoria, acknowledging that there are businesses in regional Victoria for the last 7 days or the last 6 days that had to remain shut. There was an additional top-up. That's what we're doing for Metropolitan Melbourne.
James, will there be a formal review of having a fourth lockdown? And is the government now confident that it's got the systems in place to avoid any further lockdowns?
Look, in terms of any further lockdowns, whether we're talking about Victoria, New South Wales, WA, South Australia, well, this is a global pandemic and it's impacting our nation. The path to easing of restrictions completely and living a normal life is the successful rollout of the Commonwealth's vaccination program and the construction and operation of a purpose-built quarantine facility for our highest risk people. That has always been, Rich, the path through this pandemic. In the meantime, we make our hotel quarantine system as safe as we possibly can. And if and when there is an outbreak, we absolutely run it to ground so we can get back to the life that we're enjoying just a few weeks ago.
So my first question was that will you do a review? Will there be a public review about how this is played out, and will information be released so we can see how it all played out? Rich,
we're constantly looking at the current situation, the outbreak. Every outbreak is different, and this year we're dealing with a variant of the virus that is 50% more infectious than what we were dealing with last year. It's why today I flagged the movement that we will go to having the vast majority of workplaces having a QR check-in because of the fact that we've had a greater number of infections in office environments. So we're continually looking at the situation, the how the virus is responding, what more that we need to do.
You mentioned
The Victorian opposition is calling for the health advice behind lockdowns to be made public. Do you support that?
Well, I'm very happy to deal with this myth that the Liberals are peddling around transparency. I mean, we've got the public health directions, which are publicly available. That is the public health advice signed off by Victoria's Chief Health Officer. We've got experts standing up every day answering all sorts of questions. Professor Sutton, Professor Cheng, COVID-19 Commander, Commissioner Casa from CQV, and in the Parliament, in terms of the state of emergency legislation, there is a written report provided by the Chief Health Officer monthly and a briefing to the Parliament on the pandemic. I mean, being absolutely transparent and clear with people in terms of the situation, the settings that are in place and the reasons why. This is a complete myth peddled by the Liberals.
You mentioned vaccinations before in terms of avoiding lockdowns. Other states are now opening up to younger people. Is that something the Victorian government will do soon, and priority for teachers as well?
Yeah, sure. Look, we are absolutely keen to increase eligibility, but it comes down to the level of supply that we're receiving. Now, we're at capacity. You know, the vaccines that are coming in from the Commonwealth, we are getting the vaccine into the arms of Victorians as quickly as possible. We've got a 93% utilisation rate. 40% of the nation's vaccinations are happening right here in Victoria. So we are delivering as much as we can based on the supply that we've been given. If there's a greater level of supply and even more confidence in the supply going forward, then yes, we can increase eligibility. But right at the moment, we are absolutely running at capacity, and every vaccine that we're getting, we're putting into people's arms.
Teachers?
Again, Rich, it's the same answer, whether it's age cohorts or whether it's certain sectors of our economy and industry. It's dependent on the level of supply. We were in a position that we could expand to 40 to 49-year-olds, and we did that. But as I said, every vaccine, almost every vaccine, 93% utilisation rate, it's the highest in the nation. And the reason for that is that we know that this is a race. So every vaccine that we're getting from the Commonwealth, we're putting in people's arms. If there's more supply from the Commonwealth, we'll be able to increase eligibility.
The slow pace of this reopening will have huge economic consequences for Victorians and huge mental health consequences. To what extent have you taken those considerations into account in weighing them up against what you say are the health imperatives?
Yeah, well, Professor Sutton may supplement my answer, because all of those considerations are taken into account. Mental health and wellbeing, broader society impacts, the economic impact, but this is a global pandemic. This is a health emergency, and we are not through it. We will not be through it until we have successfully, the Commonwealth's vaccine program has been successfully rolled out. But in terms of acknowledging the impact, whether that's the impact on business, whether it's the impact on particularly young people in terms of their mental health, we acknowledge that and do something about it. Over the last couple of weeks, we've now announced more than $500 million in direct business support for businesses impacted through this pandemic. In terms of children and young people learning remotely, we've got our teachers, staff, 6,000 tutors supporting them through the period of remote learning, and once they come back to school on Friday.
Acting Premier, the new Kids Helpline data has revealed a big spike in suicide attempts. In Victoria, there's a 184% spike in duty of care interventions. What role do you think lockdowns have played in this?
Oh, look, there's no doubt that the pandemic, including lockdowns, it's not just lockdowns, it's the whole pandemic, has had an impact on mental health and wellbeing, and I've been really upfront about that. We announced earlier in the year additional funding for Eating Disorders Victoria because we did see a spike through 2020, and it remains high, of children presenting to EDs with eating disorders or suicidal ideation. So we had about $215 million of additional support that we delivered last year. In the budget just a few weeks ago, we delivered the biggest investment in mental health that this nation has ever seen, $3.8 billion. I am keeping, as Mental Health Minister, a very close eye on whether it's Beyond Blue, Lifeline, other indicators that, through our health services in terms of the immediate impact. I will have more to say in terms of any additional COVID response mental health supports. I'll be in a position to do that very shortly.
And Acting Premier, there are a lot of parents saying that it should be a last resort to close schools. Are you going to take this into account if there's a future lockdown?
Moving to remote learning is a last resort. Absolutely is a last resort, and for the last couple of weeks our schools have been open for vulnerable children and for children of authorised workers. We're in a position, based on public health advice, to have our year 11s and 12s back at school last Friday, and I'm really pleased as Education Minister and a parent that on Friday all children will be back at school.
To follow that advice, or can they declare it a pupil-free day and go back on Tuesday?
No, all students will be back at school on Friday in terms of the government system, so there's no pupil-free day on Friday. Students will be back at school. In terms of our Catholic and independent schools in Victoria, that will of course be a matter for them.
Can people travel more than 25 kilometres for funerals and weddings?
In terms of funerals and weddings travelling, I believe so, but I'll come back to you on that.
Just with travel, I know that regional Victorians, no, we can't travel to regional Victoria, but can regional Victorians travel to Melbourne?
Yes, they can, but directions follow, so you need to abide by the directions.
Just on Victor's question, I couldn't hear, but can you explain the difference between weddings and religious ceremonies? So the difference between 10 and 50?
And in terms of transparency and public health advice, I'll hand over to Professor Sutton to answer that question.
Again, the international and Wave 2 experience in Victoria shows that weddings have been a source of significant transmission, and they do remain a risk of clusters occurring there. There is close interaction at weddings for human behavioural reasons that are entirely understandable, but that constraint needs to be in place with those considerations in mind. It's tough for anyone who's planned a wedding. There are people who've cancelled multiple times because we never know how new cases might emerge. So, it's an awfully tough thing to cop, but unlike a funeral, it can be deferred to another time potentially. And that's not to say it's not hugely disruptive or expensive for people to have to change those plans. But we know that the close interaction and the way that you would want to celebrate a wedding makes it a not insignificant risk of transmission in those events.
So why the discrepancy between numbers for weddings and funerals? Is weddings particularly more risky? What's the medical advice?
No, look, they both have their risks, but you can't defer a funeral. They need to take place, and so we recognise that. We are trying to say wait a little bit, and your wedding could have substantially different numbers in just a short period of time.
That's not a medical decision.
No, that's a recognition that the risk, the imperative of a wedding is not the same as it is for people who are needing to attend a funeral.
How are the investigations into the how are the investigations into the Delta leak going, and how much importance do you place on the door opening incident that Emma Cassar discussed yesterday afternoon?
It's ongoing. It's really for CQV to come back on the details of that. We're doing our bit as health to look into any potential historical cases that might be intermediaries, but nothing's turned up thus far.
In April, when you and Emma were attending the Novotel on a number of occasions to see if it was up to scratch, and it wasn't, and the managers were sacked. Of the 51 breaches during its first 4 weeks of operations,
I can stop you there. That's going to be for Emma Cassar. I can't speak
you don't
to
know what the
CQV's
breaches
operations,
were?
no.
You visited though, what did you see anything, and as a consequence of these breaches being noticed, there were people who lost their jobs. Did you see anything at that time?
So I didn't see it during an operational period. I saw it in terms of the plans and the setup and the infrastructure, and it looked fantastic, but that's a very different picture to the various challenges of operationalising it and running it over time.
Emma said yesterday that there have been offers to the residents who live in the neighbouring apartment building to meet with them. Those residents aren't aware of any of those offers being made to them directly, and in fact letters from their lawyers have been ignored. Should CQV and the health department approach and these people more directly, and I guess from a point of view of working out what the problems are, actually talk to them directly and see what their problems are from their point of view?
Yeah, look, that's for CQV to answer.
Chief Health Officer, Sky News has seen CCTV of an incident where, at this hotel that we're talking about, the Novotel.
Sorry, if you've got questions about hotel quarantine, they're really not for me to answer. It's for the Commissioner.
So is no one here able to answer the questions?
Sorry?
Is no one here able to answer questions?
Well, no one here is the Commissioner for hotel
Right,
quarantine.
would we be able to speak to her at some stage? Because we have questions.
There's your answer, yes.
Can I ask you on the tracing of the Delta variant, has anything changed in the last 24 hours? Are you still looking at the airport as being one of the most likely scenarios?
I don't know that there's a most likely scenario. We have to look at every possibility. You know, we're running down all contacts at the airport, nothing of concern. The individual involved had exemplary behaviour from an infection prevention and control point of view coming off the plane and through the airport. There's been some testing of the staff who were directly interacting. Nothing's turned up. We'll continue to look at that. The transport from the airport, again, looks perfectly okay. But something's happened and we need to try and get to that as much as possible, not just to see if there are close contacts that we need to run down now, but for any lessons around, you know, finding those gaps and those tiny improvements that might be made into the future.
How long do you think it's going to take for us to get back to those restrictions we had before this outbreak?
I hope it's as soon as possible. You know, the last few days have been terrific in as much as the new cases that have emerged have been people who are in quarantine at the time that they're diagnosed and for their entire infectious period. That really means there's no additional exposure sites, so no more primary close contacts to chase down, no more people at risk of transmission, and no more unexpected cases that might turn up over the next couple of weeks. So that's all very encouraging. And if you've got a couple of weeks like that, you can be extremely confident, but not absolutely and unequivocally guaranteed that, you know, you can go to a very substantial change.
So if this trend continues, do you imagine Melbourne will move to what regional Victoria is this time next week?
That's an aspiration, absolutely.
Chief Health Officer, just on the hotel, I'm just wondering if you could answer this one. So have we followed up on the 2 people on the same floor as the infected van at the Novotel who didn't get their day 17 and 20 tests?
Yeah, we're following up all of those. I don't have a response on the specifics of CQV's investigations at the moment.
Okay, so we don't yet know whether they have been tested or we don't know the results?
I can't speak to it. Yeah.
Okay, and also between the end of October and June, Victoria has had the highest rate of hotel quarantine breaches per case of any other state, with 1 in every 42 cases of breach. Why is this?
We have had fewer breaches than some other jurisdictions with respect to hotel quarantine. We need to look at what the causes are, but as the Acting Premier said, as every First Minister or Head of Quarantine or Public Health across the country has said, we need to look at every single aspect, every mitigation in hotel quarantine, because they are not, from an engineering point of view, the most ideal. You know, they're not open air, and so there are issues with ventilation that must be addressed. There are issues of PPE that must be addressed. All of the tracking of staff, the testing of staff, all of those things are in place in Victoria, but that doesn't make it a zero risk proposition, and we just need to continue to understand what's happening with this virus and to see if there's anything else that can be put into place.
But do you have ongoing confidence in hotel quarantine in Victoria?
Yeah, absolutely. Again, it doesn't mean that we should never consider that there isn't a risk of the virus coming out of hotel quarantine. Again, we see that lesson again and again from across Australia, and we should always look to improvements or alternative quarantine arrangements that can change that risk profile. But again, that's why the call out for testing for anyone, even when we've got no transmission across the country, is that we just never know. And so the risk of transmission back into the community will remain, and people who've got symptoms need to, be aware of that and bear it in mind when they have a cold and think it can't be COVID, but indeed it can be for those rare occasions.
Has any consideration been given of stopping flights returning to Melbourne, given this lockdown has been extended because of this outbreak in West Melbourne, which is a result of hotel quarantine?
Look, it's always under consideration, but the operations are separate and different, and the advice from the Commissioner, Emma Cassar, is that hotel quarantine arrangements can continue and they are within capacity and capability.
Chief Health Officer, we've put in place a lot of measures to improve our hotel quarantine system since the second wave, but the most recent figures that I just mentioned show that we still have the biggest issue of any state. Can you tell us why that is?
I don't know that we have the biggest issue of any state. As I said, we haven't had the most number of breaches from hotel quarantine.
That's because we've had fewer positive cases, though. The statistics that
Yeah,
Julie's
we don't
talking about
know.
relate to the number of positive cases.
This is per positive case, with 1 in every 42 positive cases a breach.
Yep.
So that is the highest rate of any state per cases. Do you
Sure.
have any idea why that is? These are recent figures.
Sure. Look, hotel quarantine is not a perfect system. It is still, and Paul Kelly's, I think, referred to this in estimates, it is still probably the most powerful and positive public health intervention that Australia could have made back in March last year. It has gotten us to that state of no community transmission that has made a world of difference on the global scale in terms of how we've managed to open up in Australia and how we've managed to protect so many Australians from long COVID, from dying. There will be ongoing challenges with hotel quarantine. We just need to continue to investigate and improve as much as possible, and where alternatives that can be built exist, we should pursue those as well.
Just on alternatives, I know it was rejected after the code inquiry. When do you think it could be safe for home quarantine to become part of the mix?
It's very hard to say. That's part of a national conversation, and AHPPC are contributing to that. But it is not at the moment seen to be anywhere near as safe as full formal quarantine within a hotel system, despite those inherent risks in hotel quarantine. Being vaccinated, 70-80% protection from transmitting to other people. That's not the same as the very, very high levels of containment that occur for the great majority of people in formal quarantine.
On vaccination, there's been a passport or a vaccine pass announced by the federal government today. Does that in any way, shape or form have a practical impact for Victorians who've had their jabs fully inoculated in terms of these restrictions or future restrictions?
Yeah, look, I haven't seen the details of it. I'd have to check. Does it relate to international travel or does it relate to domestic?
No, it's just like a vaccine passport.
Yeah, look, it's a useful thing to be able to have that documentation, understanding that these are documents that have been forged internationally. These are these become a potential currency for people with the freedoms that might be associated with them. So there's a lot of thinking through in terms of what it means for movement or whether or not people might be subject to restrictions in the same way.
So you don't have any confidence that the MyGov app would stop that forgery?
Look, I don't have the details. I haven't seen this announcement, but I think there are lots of complexities that'll continue to need to be explored in relation to them.
Will we see crowds at major events, for example, a footy in a couple of weeks' time? What's your sort of timeline on that?
Yeah, I'll take advice from the Public Health Assessment Panel in relation to public events. They've always been really thorough in their review, and I think they've always been fair in what they've allowed to occur. But I haven't seen any formal advice come through yet, so we'll just need to see that play out.
What about
the
elective
lockdown?
surgery? When is it resumed?
Look, that's a call for the State Controller, Ewan Wallace, as Secretary of the Department, but that's under consideration all the time.
So has
that from
decision
your health
hasn't been
advice?
made yet? Or-
Not that I'm aware of. At the moment, I think it's restricted in metropolitan Melbourne. It's going ahead in regional Victoria. But there are, of course, those emergency and higher category elective cases that go ahead.
So,
We've
Professor,
seen
there's
a huge
there's no
lag
health advice at
effect
the moment.
from last year as a consequence of the lockdown in terms of the wider health system. Are you worried that the pause we've just had might exacerbate that further?
Oh, of course, any disruption that defers people in terms of some of the care they get is hugely unfortunate. My role is to provide public health advice to make sure we get through it as fast as possible and as safely as possible, so that we're not dealing with either another surge in cases or grumbling cases that put us at risk ongoing.
Sorry, just on elective surgery and maybe aged care as well, but elective surgery first. You said this is a decision for you and Wallace,
yes.
But Minister Foley has previously said it's based on health advice and the moving around of people. So what is the advice at the moment from you for elective surgery to be halted?
So health advice is across the board. It relates to the commissioning and service improvement area of the Department of Health. Ewan Wallace, as the Secretary, takes my advice, takes broader advice for the division that oversees acute care. So it's a broad suite of inputs for the State Controller to decide upon.
Just back on the lockdown, you said...
So further to that point, as Chief Health Officer correctly indicated, the advice around elective surgery is a matter for the Secretary of the Health Department in consultation with the public health advice and talking to the various health services. So elective surgery has started again in the regions, and from a briefing that I've had with my department this morning, conversations are well progressed with the health services about ratcheting up over the coming days. You can't just flick a switch. Elective surgery in metropolitan Melbourne.
Is it your wish that that happens? As Health Minister, is it your wish that elective surgeries can start rolling out from Friday?
It's not my wish, it's the advice I get from my department, but I want to see every Victorian who's eligible and able to be operated on their needs as quickly as possible, as indeed does every other state. We've seen this matter rightly on the National Cabinet agenda, and we've had very constructive discussions with all the state health ministers, with our federal colleague, on precisely this matter. This issue of latent demand is a national issue. We've seen it play out in our ambulance areas, we've seen it play out in emergency departments, and we've seen it play out as emergency departments interface with the rest of the healthcare system. This is a really significant issue for the entire nation, and every jurisdiction, including Victoria, is rightly making it a priority.
How would our hospitals even go with COVID cases at the moment, Minister? How would our hospitals cope with a COVID surge if one were to happen? We don't have enough nurses, there aren't enough beds as is. Are you concerned that if we were to have another outbreak, our hospital system wouldn't be able to cope?
I'm concerned on every case of COVID. In terms of preparation by our healthcare system, as we've seen, for instance, in the private residential aged care system with the R-Care Maidstone number of cases, I think it's 3 residents out there, whether it's aged care to be immediately moved into hospitals that we're helping run, which has happened with those 3 cases there, whether it's prioritising all of the work in a number of particular hospitals that would be best placed should there be cases that need hospitalisation. We've done a lot of preparatory work with those hospitals throughout the healthcare system in a really collaborative way to be ready should that happen. But of course, that is why these public health measures that we've been taking in the past few weeks are designed to avoid that set of circumstances. The measures that Victorians have taken, the sacrifices that we've made, have avoided that very case. But should that occur, we think we've got the necessary systems in place to cope with it.
Do you know, it might not be a question for you, it could be for the acting Premier, does the easing of restrictions still have us classified as a hotspot? Because obviously if we're not a hotspot, those Commonwealth payments will stop for people?
I might defer to the acting Premier on that one.
Thanks. So in terms of the federal government's identification of hotspots and the income support that is provided, that's based on the advice of the federal CMO. So Paul Kelly would provide advice to the federal government as to where a hotspot is defined. My understanding is that following the announcements that we make tonight that come into effect from midnight Thursday, from 11:59 Thursday, Melbourne will no longer be defined as a hotspot. That is my understanding, but to get confirmation of that, you should go to the federal government.
So what do those people do? Because they're going to have that payment cut off. We've already know that sole traders are hurting. What happens for all those people? How do they put food on the table?
Yeah, look, these are the settings that the federal government put in place. They put a lot of conditions on the funding. We welcome the additional support, but do acknowledge that whether it's the conditions that they set, the taxing arrangements that they put to that funding, that is a decision that they've made. We understand that hardship doesn't end at 11:59 p.m. tomorrow night, and that's why we've announced a further $8.36 million of additional business support. It's why Minister Donnellan and Minister Wynne were out a few days ago talking about an additional $30 million of support for our most vulnerable Victorians. So I acknowledge that hardship. Business support is a responsibility of the state, and we've stepped up again today with that additional top-up. Income support is a responsibility of the federal government.
And I think you'll tell me it's a question for the federal government, but I'll ask it anyway. Do you know how many Victorians are on that payment at the moment and will effectively then come off it?
I honestly don't have those details. I know the numbers of businesses that have applied for the business support grants is in the many tens of thousands, but I don't have the numbers on the income support.
So would you be urging the federal government to continue those payments, especially for businesses like gyms and that still can't open?
I can confirm that Tim Pallas, our Treasurer, reached out to the Federal Treasurer to advocate for continuation of support. My understanding is that is not forthcoming, but in terms of questions of additional income support and continuation of that support, that should be put to the federal government.
Can I just confirm, are these restrictions easing on Thursday next week, or is that yet to be decided?
So it will be based on public health advice, as it is whenever we ease restrictions. But the expectation is that from Thursday night next week, we'll be in a position where we can bring Melbourne and regional Victoria much closer together. That would mean the travel restriction in terms of the 25K, that would go. There'll be increase or easing of restrictions for venues. Community sport competition will resume. So bringing Melbourne and regional Victoria further together, and also announcing where we can further easings of restrictions for regional Victoria.
And when do you anticipate the gyms and nightclubs and the like will open? Is that like a further 2 weeks?
As Professor Sutton said, for gyms, for example, in Melbourne, we need a further 7 days where they will be closed, and to support them we've provided this top-up funding. But our expectation is Thursday night next week, we'll be able to have our gyms open, as they will be able to from Thursday night this week in regional Victoria.
You said this lockdown was reviewed on a day-by-day, hour-by-hour basis. Given this announcement was likely agreed on last night or early this morning, why can't the lockdown be lifted tonight?
This is about making sure that we provide notice for people in terms of what the easing of restrictions will mean, and it's based on the public health advice. Where we can bring things forward, as we've done for the last 16 months, we do. Where we can provide further easings, we do. But the advice from public health is that this will take place from 11:59 tomorrow night.
Is there a reason kids couldn't have returned to school tomorrow?
Again, it's based on public health advice. Kids learning at home through remote learning is an absolute last resort, and getting students back to school is our highest priority. We're getting them back at school as quickly as possible, and that means, thankfully, on Friday, all students are back.
Were you briefed on the infection control breaches at the Novotel when the two managers were stood down? And if not, have you subsequently asked and learned what they are in light of the new information about the man staying there?
Look, that's obviously a responsibility for Commissioner Casa and the Minister responsible for CQV. Of course, I get updates all the time in terms of improvements that are made and responding to issues as they unfold. But in terms of the day-to-day management of our hotels, that's the responsibility of Minister Pearson and Commissioner Cassar.
Wouldn't you be deeply interested in why the managers of one of the quarantine hotels were stood down in light of dozens of breaches over a space of 4 weeks? Do you not know what the breaches were?
Look, it's appropriate in terms of operational matters. That is a responsibility of Commissioner Cassar. That is absolutely appropriate.
You're in charge though, and evidently there were problems at this hotel. There's now the distinct possibility that this hotel is what caused one of our outbreaks. Don't you have a responsibility to find out?
Look, in terms of whether it's the health system, the Secretary of the Department of Health and the Minister for Health is responsible for the health system. And housing, there's a reason why we've got cabinet ministers and secretaries of departments. They are responsible for the operations in their specific portfolios. My responsibility as acting Premier is to ensure that our response to the pandemic, the easing of restrictions, is done in the best way possible. We have a CMC, which is the Coordinating Ministers Committee of Cabinet, meeting every day, particularly through this outbreak period, making sure that in terms of CQV operations, COVID-19 response, contact tracing, public health advice, all of those things are discussed in detail to make sure that we keep Victoria as safe as possible. Day-to-day operational decisions are absolutely the responsibility of those respective commissioners and secretaries and ministers.
Acting Premier, I can't see anything here about aged care homes. Are visits allowed at aged care homes?
No change to aged care.
Even in regional areas?
Yep. So same settings that we have today in regional Victoria and metropolitan Melbourne continue.
Acting Premier, in terms of bringing the lockdown forward, you said it's based on public health advice. Can we ask the show what that public health advice is?
Yeah, absolutely.
So in terms of bringing the lockdown forward, why can't we do that now?
We've needed to see how the cases have emerged over the last few days in order to have that level of confidence. You can't flip a coin and say, I hope, with a 50-50 chance that we can get control of this. The prospect of ongoing transmission, the prospect of a return of an epidemic of either the Kappa variant or the Delta variant is pretty awful. We are looking to snuff it out completely. We have to take that path, and so you have to have sufficient confidence that the measures in place and the timing of easing of them do that. And we've needed the last few days to see that new cases are emerging in people who are already in quarantine, no new mystery cases emerging, the number of primary close contacts decreasing by hundreds as it has each day, and indeed the number of exposure sites now down to 160 odd. Those are the things that give my team the confidence that this is the appropriate time to make those changes. But it's not a case of flipping a coin and hoping for the best.
So I guess I meant in terms of waiting until midnight tomorrow, why can't we just start at midnight tonight?
So there's complex legal drafting to be done. That needs to be measured against all of the charter considerations for each and every charter obligation that is in play with restrictions, and to make sure that it's not a sloppy process. We have to go through with a fine-tooth comb to make sure that every single drafted piece with the public health directions are appropriate and correct.
What's the you're talking about public health advice? What's the advice that allows in regional Victoria 100 people to go to a brothel in one day, but you can only have 2 visitors to your home?
So visitors to the home are a particular cumulative risk. We're talking about hundreds of thousands, millions of homes across Victoria. When you have a particular easing of a restriction for an indoor environment, the most high-risk environment indeed for transmission for coronavirus, you have to look at the cumulative effect of what it means to allow 2 people plus dependents, excluding kids under 12 months, across those hundreds of thousands of homes. For other venues, you are also looking at the cumulative risk, and if there are only 3 or 4 of those venues, if there's no casinos, if there's a few other settings that you're talking about easing restrictions, the cumulative risk is not the same as what it means to change the settings for a private gathering. Of course, if you're just looking my home versus what I'm able to do in another particular setting, it looks out of accord, but we have to look at what it means to make those changes across the board, understanding what it means for millions and millions of person-to-person interactions.
What are the factors that would trigger another lockdown?
Sorry?
What are the factors that would trigger another
The same thing as I've said every single time.
Are you concerned that we're going to see mystery cases in the next few days, and if we do,
No,
what
I
will
don't
happen?
think so. I think every day that goes by with high testing numbers, and again, if we can get 25,000 plus tested every single day, that would be terrific. And if those test results are coming back negative for all of those cases, that would be very encouraging.
Professor Sutton, we've already heard about restrictions easing in Melbourne next Thursday, hopefully.
Yep.
Will restrictions also ease for regional Victoria? Will we still have that difference, even though we're allowed to travel between the two
Look,
areas?
I hope so. We need to see what the week ahead has for us.
And just on community sport in regional areas, are they allowed to have crowds, or does that 20-person gathering limit outdoors apply?
So there are public gathering limits, but for indoor, it's a case of a venue limit and a minimal required number for that competition to go ahead.
Outdoors, though, at local footy or the local netball in country areas, how many people are they allowed to have in a crowd?
I'd have to come back to you specifically. I think it's the outdoor gathering limit.
Last question, just on vaccinations, not sure if this is one for you or the Acting Premier. Will police receive priority? Some have been told to call the COVID hotline to make a booking.
Certainly they're in the 1B priority grouping, but I don't know if there's anything else to add in that regard. Police as a priority for vaccination.
So today marks the start of the Ambulance Victoria First Responders Blitz in the state's walk-up and mass vaccination centres right across the state. And we're working closely with the workforce at Ambulance Victoria and Ambulance Victoria to make sure that we lift those rates. We've also been working through the vaccination teams with Victoria Police. Victoria Police are a little bit different in that because so many of them are rotating through the hotel quarantine system as a key part of the security and workforce there, a significant number are already fully vaccinated through that system. But we're looking to how the next wave of priority groups can start to finalise those 1A, 1B groups, particularly amongst our first responders.
So at this stage, they still, I guess they still have to call the COVID hotline, or
Beg your pardon?
do they still have to call the COVID hotline?
No, we're working through those arrangements with Victoria Police as to what the best system is for them. Any Victorian citizen over 40 can go to their GP if their GP is participating, and can go through the Victorian Mass Vaccination Centre. But in terms of trying to target specific groups such as Victoria Police, Ambulance Victoria, as we've done with private residential aged care, disability workforces, we're trying to make sure that within the constraints of the supply that we have, that we balance the huge demand we're seeing from Victorians over 40 and over 50 more broadly with the need to get those priority groups done and dusted as quickly as we possibly can. And Victoria Police, Ambulance Victoria and the other frontline responders, together with our health services, have been extraordinarily cooperative, and I want to thank them for their efforts in that.
A lot of the regional travel. If people do have to pass through Melbourne, would you be discouraging them from, staying in Melbourne, having a coffee or lunch? Would you be encouraging them to instead go from point A to point B?
Oh, look, we'd encourage common sense and the best arrangements possible. By the geography of Melbourne and the geography of Victoria, we know that as we encourage intra-state tourism from our regional communities around regional Victoria, that movement necessitates engagement with metropolitan Melbourne. The thing is, as the draft orders make clear, we want to make sure that you travel your restrictions with you and that you keep to the rules. So keep to the rules, apply common sense and stay safe.
Acting Premier, just one last one on the regional Victorian tourism businesses that are... Yeah, sorry, I'm looking at him, sorry. Just on regional tourism businesses that are obviously missing out on Melbourne people this weekend, what's your message to them? Lots of them crying out saying there's really no point having regional Victorians visit because it's such a small amount compared to what they're used to.
Look, I just want to acknowledge that this is absolutely a hardship for businesses across Victoria, particularly for the long weekend in terms of regional accommodation, regional tourism operators. I understand how difficult this is, but we've got no choice other than to follow the public health advice and drive this outbreak into the ground. It's why we were very honest and upfront very, very early to say that even when we could get to the next stage of easing restrictions, there will be a period of time where we'll have separate settings in Melbourne and regional Victoria. It's why we acknowledge that through the additional business support focused on regional tourism and accommodation. There will be regional tourism and people moving across the state in regional Victoria, but I know that wouldn't make up for the loss of Melburnians travelling to regional Victoria. I understand that, and that's why, over the last couple of weeks, $500 million of additional support.
A lot of multicultural schools continue to operate during lockdown, but they've lost a lot of students through remote learning. Will they be eligible for support?
Is this in terms of the community language schools?
In terms of community schools, private, and will they be eligible for support?
I'll have to come back to you specifically on community language schools. I know this is impact, and I speak to local sporting clubs as well in my community, and there was a drop off in some sports in terms of participation as parents were making choices about maybe not doing 3 or 4 activities that they were doing last year or the year before, but 2 or 3 activities. But I'll come back to you specifically on community language schools.
Acting Premier, we're no longer considered as livable as Adelaide or Perth, but we're still in the top 10. Is Melbourne even... do we deserve that?
Do we deserve being in the top 10?
Yeah.
Absolutely we do. This is the best place in the world to live, Victoria and Melbourne. We're going through a tough time at the moment, but it is still the best place to live. I love being a Melburnian, and we look forward to climbing back up that ladder over the next few years.
Willie, there was a report this morning tabled from the Commissioner for Children and Young People and Aboriginal Affairs saying to raise the age to 14. Is that something the government will do, criminal responsibility?
Yeah, look, this is a very important national debate, and we are absolutely participating in that national debate in terms of criminal responsibility and the age level. So, Rich, this has been answered a number of times. I acknowledge this is a very, very significant national public debate. The Attorney-General, other ministers in the Victorian Government are absolutely engaged in this debate. We'll see how that plays out, but we're participating in it. It's a significant issue.
But it is state law. The Crime Act is a state-run law.
Yeah, it is, but as is often the case, state law, state responsibility, but a national debate through the meetings of Attorneys General and other ministers. We often debate, I do it as an education minister, where we're the system managers, states and territories, but we have national debates on issues of national significance. The age of criminal responsibility is one such debate.
But the ACT broke in ranks, so why can't we do the same?
Well, I don't have any announcements to make today other than to acknowledge, and I've done this on the floor of Parliament as well, this is a significant issue. It is subject to discussion around the Victorian Cabinet table, and it is part of a national debate that we're participating in. Excellent. Thanks all.